Hello everyone, and welcome back to our channel. Today, we're diving into a topic that affects millions of people around the world, that is migraines. In this video, we'll explore what exactly migraines are, what causes them, their symptoms, and most importantly, how to manage and cope with them. So, let's get started. Migraines are more than just severe headaches. They're a complex neurological disorder that comes with a range of symptoms. The term migraine itself comes from the Greek word hemicrania, which means half of the skull. This name reflects the common observation that migraines often affect only one side of the head. Certain foods and beverages can trigger migraines. These may include aged cheese, caffeinated drinks, alcohol, particularly red wine, and processed foods high in preservatives. Stress is a significant trigger. Elevated cortisol levels can set off a chain of events leading to a migraine. For many, especially women, hormonal changes can be a significant trigger. Fluctuations in estrogen levels during menstruation, pregnancy, or menopause are often linked to migraines. Environmental factors like bright lights, loud noises, or strong odors can also set off migraines for some people. Both inadequate and excessive sleep can serve as triggers. Besides triggers, certain risk factors make people more susceptible to migraines. These include family history of migraines. Age, common onset is adolescence. Gender, women are more affected. And other medical conditions like depression or anxiety. Identifying your triggers and understanding risk factors can empower you to manage migraines better. Let's get started by understanding the underlying mechanisms that drive this condition. To comprehend the pathophysiology of migraine, we need to take a closer look at the brain. Our brain is a network of nerve cells, or neurons, that communicate with each other through electrical signals and neurotransmitters. In migraine, the balance of these neurotransmitters becomes disrupted, leading to a cascade of events. Let's break down the pathophysiology of migraine into several key stages. Cortical spreading depression is often considered the initiating event in many migraines, particularly those with aura. This is a wave of electrical hyperactivity followed by a period of inactivity, traveling across the brain's cortex. This phenomenon triggers a sequence of neurovascular changes. As cortical spreading depression occurs, it leads to the activation of the trigeminal nerve system. This is a complex neural network involved in facial sensation and motor functions. Once activated, this system sets off a cascade of events that lead to the migraine headache. Upon activation, the trigeminal nerve releases various vasoactive peptides, most notably CGRP, calcitonin gene-related peptide, and substance P. These substances are key players in causing inflammation and dilating blood vessels. The release of these peptides triggers a range of vascular changes. Initially, there might be vasoconstriction, or narrowing of blood vessels, followed by vasodilation, or widening. This vasodilation is often what contributes to the throbbing pain characteristic of migraines. As the migraine progresses, the central nervous system becomes increasingly sensitized, making you more susceptible to pain and other stimuli like light and sound. This is often why symptoms persist even after vascular changes have normalized. Understanding the phases of a migraine can help you manage symptoms and possibly even ward off an attack before it hits full force. The first phase is what's known as the prodrome phase. This phase can occur hours or even days before the actual headache starts. Common signs during the prodrome phase include mood changes, fatigue, and food cravings. Some people even experience stiff necks or increased yawning. Knowing these early signs can alert you that a migraine may be coming. Next up is the aura phase, which not everyone experiences. Those who do experience auras may see flickering lights, spots, or zigzag lines. Some may also feel tingling sensations in their face or extremities. These symptoms typically last for about 20 minutes to an hour. The third phase is what most people associate with migraines, the headache phase. This phase can last for a few hours to 3 days. The pain is usually throbbing and occurs on one side of the head, but it can affect both sides. Sensitivity to light, sound, or smell is common, and some people may even experience nausea or vomiting. The final phase is the postdrome phase. After the headache subsides, you may still feel wiped out. Fatigue, body aches, and even a mental fog are common during this phase, which can last for up to a day. Migraine is a diverse condition with various subtypes. Migraine without aura is the most common, with throbbing pain and sensitivity. Migraine with aura involves visual disturbances and other sensory symptoms. Chronic migraine is persistent, while hemiplegic migraine mimics stroke symptoms. Vestibular migraine causes dizziness. Retinal migraine leads to temporary blindness. And basal-type migraine involves various neurological symptoms. To diagnose migraine, comprehensive understanding of a patient's medical history is paramount. This includes symptoms, triggers, and characterizing the headache, that is, determining their type, location, duration, frequency, and intensity. Insight into the patient's medication history and previous diagnostic tests is also crucial for accurate diagnosis. The physical examination entails a series of assessments aimed at excluding other potential causes of headaches. Blood pressure measurement helps rule out hypertension, while an examination of jaw or scalp tenderness is crucial in patients to identify potential temporal arteritis. Additionally, an eye examination with an ophthalmoscope helps spot signs of increased intracranial pressure or other ocular conditions. The neurological examination involving cranial nerves, reflexes, motor and sensory function, coordination and balance aids in pinpointing any neurological signs indicative of migraine or other conditions. The International Classification of Headache Disorders, or ICHD, provides specific criteria for diagnosing migraines. A typical diagnosis would require at least 5 episodes that last from 4 to 72 hours, among other criteria. In most cases, a thorough clinical examination, coupled with the patient's history, is sufficient for diagnosing migraines. However, in instances where symptoms are atypical or when there's a suspicion of stroke, bleed or tumor, imaging studies like MRI or CT scans might be recommended. Additionally, a lumbar puncture could be performed to investigate infections, bleeding, or other conditions. Now, let's move on to the treatment options. One of the first steps in managing migraines is making certain lifestyle changes. These can include maintaining a consistent sleep schedule, staying hydrated, managing stress through techniques like yoga and meditation, and avoiding trigger foods like processed meats, aged cheese, and excessive caffeine. Over-the-counter medications can provide relief for mild to moderate migraines. Non-prescription pain relievers like ibuprofen and aspirin can help alleviate pain when taken early in the migraine attack. Just remember not to overuse these medications, as it could lead to rebound headaches. For more severe migraines or those that don't respond well to over-the-counter medications, prescription medications are available. Triptans are a common class of medications that work by constricting blood vessels and reducing inflammation in the brain. If your migraines are frequent and debilitating, preventive medications can be taken regularly to reduce the frequency and severity of migraine attacks. They include medications like beta blockers, antiepileptic drugs, and antidepressants. Botox injections have been approved for the treatment of chronic migraines in some cases. These injections work by blocking certain nerve signals that trigger migraines. A relatively new class of medications known as CGRP inhibitors has shown promising results in preventing migraines. CGRP is a protein involved in pain signaling. These medications work by blocking the effects of CGRP, thereby reducing migraine frequency. In addition to conventional treatments, some people find relief through alternative therapies such as acupuncture, chiropractic care, and biofeedback. And there you have it, a comprehensive guide to understanding migraines. If you or someone you know suffers from migraines, remember that seeking medical guidance is crucial for effective management. Thanks for tuning in, and be sure to subscribe for more enlightening content.